Good Friday afternoon. I'm Dr. Martha Buchanan, Public Health Officer and Senior Director here at the Knox County Health Department. Our moment of gratitude is dedicated to the folks who are looking out for our neighbors by donating blood. Sunday is World Blood Donor Day, and we are so appreciative of the folks who are continuing to safely give blood, as we know that blood donations are incredibly valuable to so many people. Thank you again for your selflessness. If you are interested in giving blood, Medica is a great resource in our community. We want to begin by letting you know that we have resumed distribution of the cloth face coverings provided by the state of Tennessee. Following the state's recommendations and their discussion with the EPA that these are safe for individuals to wear. Folks can get these cloth face coverings at our main location at 140 Dameron Avenue between 8 a.m. and 4:30 p.m. Monday through Friday. We also have some community partners who are distributing masks as well. Now I want to spend just a few minutes talking about the reopening plan. Previously, we had mentioned we would reevaluate where we stand today and make an appropriate recommendation at this time. However, the county law department has advised us that we must first consult the county's Board of Health regarding our phased reopening. Our next Board of Health meeting is scheduled for Wednesday, June 17th from 5 to 7 p.m. This meeting will be available for the public to watch. More information will be made available to the media today on how you can view that meeting. Regarding next phases, as Charity will talk about, the data looks good at this point for continued progression, but we will wait to make any recommendations on what the next phase will look like until after the Board of Health meeting. Today, we will continue to provide an update on the benchmarks, and for that, I'll turn it over to Charity.
Hi, good afternoon. Beginning with our local situation, we have 547 cases of COVID-19 in Knox County. Additionally, we have 12 probable cases. 431 of those cases have recovered. 52 individuals have been hospitalized at some point in their illness, and we have 4 Knox County residents currently hospitalized. We're thankful that we have no additional deaths to report due to complications from COVID-19. Now we'll transition to the benchmarks. As a reminder, for the majority of our benchmarks, what we want to see is no 3-day statistically significant shifts within a 2-week time period. Every day we will look back at the previous 2 weeks. That's what a rolling average is. Overall, what we mean by this is we are trying to see that things are staying the same, or are they getting worse? And if so, how much worse? Moving to the first benchmark, sustained reduction or stability in new cases for 14 days. To illustrate this benchmark, we have a bar graph that shows previous cases, new cases, and the daily growth and the growth rate over time. We experienced a 3-day statistically significant increase in new cases. This increase caused us to keep this traffic light as red. It is important to note that this increase came at the very beginning of the 14-day time period. Since then, daily case counts have increased, but they are plateauing a bit from the sharp increases noted at the end of last month. This means we are seeing a more steady and stable increase in cases, which is what we've been talking about to expect and that we are able to handle at this time. We want to stress to our community that this virus is still very present in Knox County, and we continue to stress the importance of the 5 core actions. Our second benchmark, community-wide sustained and increased diagnostic testing with consistent or decreased test resulting reporting turnaround time. For this benchmark, we are utilizing 2 bar graphs, one that shows a sample of the tests conducted for Knox County residents and another for average time between specimen collection and lab report data. What we want to see is the amount of testing staying the same or going up, and lab reporting time staying the same or decreasing. Based on the qualifications we mentioned for a shift in the traffic light colors, this benchmark meets the qualifications for green. Our third benchmark, sustained or increased public health capacity. This chart shows the number of individuals currently on our epidemiology support team. At our current number, we are able to effectively perform our contact tracing and investigation responsibilities. Last week, we mentioned that we would be refocusing this benchmark on time it takes to make contact with cases instead of staffing capacity. While we continue to publish our staffing capacity each week, we are now evaluating this benchmark based on the time it takes to initiate new case investigations and begin contact tracing. As we mentioned in the reopening plan, we aim to reach out to cases within 24 hours and close contacts within 48 hours. To date, throughout this pandemic, we have accomplished that for all of our cases and all of our contacts. Because of that, this benchmark continues to be represented as green. As a reminder, we are working to expand our team even further due to the expected continued increase in individual cases and clusters and contacts associated with those. Our fourth benchmark, healthcare system capabilities remain within current and forecasted surge capacity. These graphs show the availability of regional hospital beds, ICU beds, and ventilators from our hospital partners. It also shows that the additional surge capacity for these categories, as well as the COVID positive patients and the patients with pending test results in the hospital. These data are gathered from the information hospitals put into the Tennessee Healthcare Resource Tracking System, or HERTS. It may reflect Knox County, East Region, or patients from other jurisdictions. For this benchmark, the traffic light remains green. While we did experience a few days of statistically significant increases, as we have stated previously, because the number is so low to begin with, even a small increase registers as statistically significant. As always, decisions regarding how to classify this benchmark as green, yellow, or red are made in concert with our hospital partners, as well as taking all of the data into consideration. We do want to note, while the numbers of COVID patients in the hospitals are relatively small, they are continuing to trend up. We are watching this very closely. This again demonstrates that the virus is still present in our community and impacting our neighbors, which is another reason we continue to recommend and encourage everyone to follow the 5 core actions to reduce the spread of disease. Our fifth benchmark, sustained or decreased COVID-19 related death rate for identified positive or probable cases. For this benchmark, we show the chart that details cases, hospitalizations, and deaths. This benchmark remains green because we thankfully have not had an increase in deaths. Now with that, we'll open it up for questions.
All right, please go ahead and submit your questions into the chat feature. Any questions? Please go ahead. Thank you. And just a reminder to please type in your name and the media outlet in which you're with. From Jim with WBIR. The governor announced long-term healthcare facilities, nursing homes, assisted living can allow limited visitation starting Monday. Those facilities fall under state guidance. Has KCHD received any additional guidance or information regarding the announcement and the county's role in nursing home visitation?
We have not received any additional information at this time. We received the same information that you guys got from the governor's office on that. And so questions we would direct to the governor's office for that process.
From Brian Hornback, is there a need for the reopening task force? Can their work be accomplished through the Board of Health? And we'll have Dr. Buchanan come in for that question.
It's a great question, and that's a decision for the Board of Health. So ultimately, they'll make that decision on Wednesday.
Any other questions? Please go ahead and submit them now. From Jeff with Sorry, everyone, I just accidentally muted myself. I was trying to let someone in. From Jeff with WATE, can you tell us about the change when it comes to releasing the phase 3 guidance? What is that process?
So the Board of Health will meet and decide what plan to follow and how we move forward. That'll be a discussion with the Board of Health in an open meeting. So I don't know what the answer is going to be because I have to wait on the Board of Health to advise me.
Any other questions? Please go ahead and submit them. From Claire with WUOT, according to the graph in benchmark 2, the average number of days to receive test results has increased since the beginning of May. Can you explain why?
There is, it's not statistically significant when you look at that, but I will say that's true. And there are a lot of different testing initiatives and efforts that are happening right now, which can impact test resulting times. So for example, all of the long-term care facilities are testing all of their patients and staff members. There's all the community testing we're doing, more community testing out in the public with our hospitals and doctors' offices. All of that can have impact. We just don't want it to start seeing huge increases. But really, I think it was maybe a tenth or 2/10 of a difference in days of what it was last week to this week.
Any other questions? Please go ahead and submit them. From Jeff with WATE, when will the epidemiology staff be increased in size and by how many staffers?
Well, our epidemiology staff, the epidemiologists themselves, there's 4 of them on staff here. There's not plans to increase those. What we are doing is bringing in additional support teams. If we start, and we are preparing for this, if we start having issues with being able to very rapidly respond and initiate investigations for our cases and then talk to our contacts and do what we need to do with them, that's as when we start, we would need to grow our staff, and we want to do that in advance of getting to that point. So that's why we're preparing for that. The key point here, and what everybody needs to know, is the whole purpose of this is to rapidly get new cases into isolation, so there's not additional threat of spread from that person in the community, and then also to get their contacts into quarantine. And that's why we really want to focus on the time frame that we're meeting more than what the staffing numbers are.
His follow-up question is asking, well, what about the contact tracing staff? I believe Charity answered that there, but is there anything else you want to say?
I mean, we're every day working on and preparing to bring in additional staff. We haven't had to right now. This week has been mostly focused on preparing to bring them in and have them available for us when they become needed, and start getting them some practice and doing the work that we do. But as far as where we go from now, that's really up to what the caseload looks like. And again, our time frame for being able to respond efficiently. We thus far, all of our cases and all of our contacts have been reached. We're reaching out to them, making attempts to get them within 24 hours. So we're not even doing the 48 hours for contacts at this point. The other point to make is contact tracers don't equal epidemiologists always. So again, we have those 4 epidemiologists, but there's a lot of different folks helping us, from our nursing staff to our non-clinical staff that have really good customer service skills, and looking at bringing on additional support for that.
From Jim with WBIR, you mentioned the mask distribution. Can you clarify if the masks have changed, or did the EPA deem the old masks with antimicrobial to not be problematic?
Yeah, it's the same mask that the Tennessee Department, or so the state government provided us to us before. The EPA, DuPont, the chemical maker, and the mask maker all across the board said that the specific chemical in the mask were safe for people to use. And the Tennessee Department of Health agreed with that, and we were given the guidance to resume distribution of those masks.
From Brian Hornback, Ryan, please ask the health. I'm not sure who Ryan is, but I think the question is, please ask the health department why they don't specifically state the number of active COVID-19 cases in Knox County each day. Instead, it's left for folks to quickly jot down the total number of cases and the total number of recoveries.
Yeah, we really are focusing on, I mean, new cases are important to us, and being able to maintain the full caseload that goes with investigating new cases, monitoring current cases, talking to new contacts, and then getting daily monitoring, talking to all of our contacts every day, making sure they're doing well. But we are actually talking about providing that information moving forward. The information's on the website, and we'll continue to look at how we present the data in these briefings as well. That we had actually that very discussion right before we had this briefing today. We just didn't have time to switch it.
And just to reinforce, we do report those active cases on our website every single day. So there is a section where we do say the active number of cases. From Claire with WUOT, what targeted testing efforts do you have planned in the coming week?
Our person, our director of nursing, is who works that plan, and she's not here today, and I'm not positive what those are. I do know there are some coming up, and we'll have to report on that Monday.
Any other questions, please go ahead and submit them. From Jim with WBIR, we had someone ask how many reopening phases there are total. Forgive my ignorance. And Dr. Buchanan will come in to answer that question.
So the plan is written that was created has 3 phases. Again, that could change after the Board of Health meeting. So right now it has 3 phases.
Please submit any additional questions into the chat feature. From Jeff with WATE, can you tell us more about the law department telling you that the Board of Health meeting was required?
I think this is uncharted territory for all of us. And as the law office looked at the situation and their legal interpretation of where we are under the emergency orders and other things that are in place that aren't always in place, they really felt like the plans were really policy documents and as such required Board of Health approval. So we're moving forward with doing that. I don't know if they'll approve those. It'll be up to the Board of Health what direction we take.
Any additional questions, please go ahead and submit them into the chat feature now. All right, since we're not seeing any additional questions come in, we'll end the briefing. Thank you all for joining us, and we will see you again on Monday at the same time. Have a good one.